So we begin in Gaza, where more than 1 million people have been forced to leave Rafah in the south. That's according to the UN Agency for Palestinian Refugees, UNRWA. Many of the displaced have had to move several times during nearly 8 months of war. Israel has been expanding its offensive in the southern city, which it designated a safe zone. More than 3,500 children are at risk of dying of starvation. That's according to Gaza's government. It says they're suffering from malnutrition as critical humanitarian aid and medical supplies for Gaza have been halted since Israel took control of the Rafah crossing last month. Hospitals in Gaza are overwhelmed with patients in critical conditions. Israeli strikes are continuing across the Strip. At least 28 Palestinians have been killed on Monday. Let's bring in our correspondent in Deir al-Balah in central Gaza, Hani Mahmoud. Hani, you're standing there in front of a hospital. Tell us about the conditions for doctors and for patients, many of whom have been displaced several times.
Yes, Laura. Well, by the hours, we're looking at quite dire situations, keep evolving into much more complexity inside this hospital. We happen to be reporting it from the courtyard of the only operational health facility in the central area, being providing health services for not only the local residents, but for all the displaced families from the past 8 months coming all the way from the northern part of the Strip, Gaza City, and more recently, influx of more displaced families from Rafah City and Khan Yunis, given the ongoing intense bombing campaign that keeps pushing people into further internal enforced displacement, adding more pressure on this particular health facilities. Doctors here inside the hospital, we're talking about exhausted medical staff, been working for the past 8 months non-stop. They suffer from the acute shortage of medical supplies. For the most part, we're seeing injuries and patients inside the hospital, literally on the floor of the hospital, because it simply ran out of space. It doesn't have the capacity to accommodate this large number of injuries, and on top of that, the patients and other cases are transferred from other hospitals, just adding more pressure on everybody inside the hospital. It's also important to point out that the courtyard of the hospital turned into a displacement camp for evacuees from different parts of the Strip. Literally, wherever you walk here, you would see tents that set up by evacuees and displaced families inside the courtyard of the hospital, posing more difficulties and challenges for paramedics, civil defense crew, medical staff. Everything is quite facing a challenge. To get a better picture of what's going on inside the hospital, we're joined by Tia Gochardo. She is the Director of Development from Miglia. Tia, thank you so much for joining us. What is the situation in hospitals?
The situation in hospitals today is beyond catastrophic. What we've been witnessing since October is a complete systematic destruction of hospitals by the Israeli military, starting in the north, working their way all the way down to the south. As you said, Hani, there are few operational facilities. We've got one semi-functioning hospital behind us. Patients aren't able to access the healthcare that they need, and doctors aren't able to provide the resources that they require in order to provide healthcare services.
Tia, can you share with us your personal experience and how your work here has been going?
Sure. So Glia has been in Gaza providing support through medical delegations since February. We've been bringing in international healthcare workers to assist in the hospitals. Specifically, we were helping in Rafah, in Tel El Sultan Primary Healthcare Clinic and Emirati Hospital. And I now have some emergency nurses here at Al-Aqsa Hospital. And each delegation will be bringing in medical supplies with them, medicine and equipment that were desperately needed, but were never enough.
I understand this is not your first time in Gaza. You were here back in March, and you're back again within the past couple of weeks. Can you describe the scale of deterioration inside hospital, the healthcare system in general?
Sure. Yeah, the situation has gone from bad in March to worse now. So I was in Rafah when the evacuation orders were issued before the Israeli army made its incursion into that area. And what we saw was initially at least hospital and healthcare spaces that were being used by many, many people. We had a large influx of people into Rafah. So these spaces were seeing about 1,200 patients a day. Once those evacuation orders were issued and about 900,000 Palestinians moved out of Rafah into the Mawasi area and up north, those hospitals emptied out as well. That didn't mean they didn't need the services. They desperately needed the services, but they were too afraid to go into the hospitals to seek those services because everyone saw what happened in the north, and nobody wants a repeat of that here in the south. And so we had a lot of patients who were requiring healthcare who weren't accessing it because they were afraid, or they were on the move and couldn't access it because they were now displaced once again. Right, we're talking about a population that has to move 3, 4, 5 times desperately in search of a better, safer space that we all know simply doesn't exist.
Yeah, in light of what we're seeing now, there's no let up in the attacks, no slowdowns meant by the Israeli military. What are the major medical needs right now? We just saw a few minutes ago injuries keep coming to the hospital. What are needed right now in like major medical needs in Gaza?
Yeah, literally everything. I cannot overstate what is needed. Every single item is required in these hospitals. I mean, we're looking at people who have chronic cases, for example, people who are suffering from cancer, who cannot access their medications. We have people who have kidney failure, who cannot access the resources that they need in order to sustain their life. And then combine that with the high amount of trauma cases that we're seeing in these hospitals, and they don't have the gauze, they don't have the splints, they don't have the tourniquets to treat these patients. But I think it's also important to note that personally, I don't think that what the hospital needs are more of things. What they actually need is a cessation of things. They need to stop to things. They need to stop to this war. Right? As soon as this war ends and we can open up the borders, then the solutions begin to flood, and then we can get the aid, then we can get the humanitarian workers, then we can help give a break to these exhausted and traumatized healthcare workers.
Tia, thank you so much. Thank you. So as we heard from the Director of Development from Gilead, the situations are beyond catastrophic. It's perhaps better described as a crisis above emergency inside health facilities. And we see it every day inside the corridors of this hospital right here in Deir al-Balah city, where people are on the floor of the hospital or in overcrowded rooms and with the inability to intervene and provide proper health services and intervention, it's becoming very, very difficult to sustain the operations of these hospitals.
Hani Mahmoud in central Gaza there for us. Thanks very much, Hani.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.